Good afternoon, colleagues, excellencies, delegates. I sincerely hope you've all had a nice lunch and a short rest. Welcome back. We will now resume our consideration of Agenda Item 7, addressed by the report of the Regional Director, document WPR/RC76/2. And as usual, if you wish to speak on this item, please click the right button on your microphone. And as such, the list has been corrected. And the next speaker on my list is New Zealand, to be followed by Cambodia. New Zealand, the floor is yours.
Thank you. Bula Vanaka, Mr. Chair, Ministers and distinguished delegates, I'm delighted to be here at the 76th Regional Committee meeting, and I particularly wish to acknowledge our Regional Director, Dr. Saia, Piukala, and sincerely thank the Government of Fiji, and in particular the Fijian Minister of Health, for hosting this week and for your hospitality. I would also like to take this opportunity to welcome Indonesia to their first Western Pacific Regional Committee meeting. New Zealand is progressing an ambitious direction for health, focusing on a number of key health targets. Firstly, improving childhood immunisation rates, faster treatment for cancer, shorter stays in emergency departments, shorter wait times for specialist appointments, and elective treatment and shorter wait times for elective treatments. We're also making a significant investment into improving access to primary care and mental health, which is a key focus. Scaling up community-based services and supporting our workforces to deliver the right support at the right time. We know there is more work to do, and our government is focused on building a health system that is accessible, effective, and centred on the needs of every New Zealander. Chair, as a region, we are diverse, but the challenges in our health systems intensified by natural disasters and the impact of climate change also affect us. And as we meet in the middle of the blue Pacific continent, I acknowledge the impact that climate change can have on many of our Pacific Island states and territories, and New Zealand supports the regional implementation plan for the Global Action Plan on Climate Change and Health that will be considered this week. Chair, I'd like to acknowledge the significant reform and reprioritisation work that has been undertaken by the Regional Director and his team this year. The scale, complexity and persistence of global challenges puts significant pressure on the multilateral system, including the WHO. Reform efforts need to rise to the scale of the current structural, fiscal and geopolitical challenges we face. New Zealand is taking a back-to-basics approach to manage increasing demands on our health system within the resources which are available to us. And I encourage the WHO to take a similar disciplined approach to reduce efficiencies, deliver value, and particularly at the country level. In this increasingly complex environment, I'd like to reaffirm New Zealand's commitment to multilateralism and to working alongside our regional neighbours and the WHO to build a healthier future for us all. Thank you very much, and vina ka vaka levu. Thank you.
All right. Thank you very much, Minister. And now go invite Cambodia, to be followed by Hong Kong Special SRA, China.
Honorable Chair, Honorable Regional Director, distinguished delegates, ladies and gentlemen. It is my honor and privilege to address the 76th session of the WHO Regional Committee for the Western Pacific. The Regional Committee meeting aligned deeply with Cambodia's vision for a healthier and more resilient future that recognizes the interconnectedness of health system, economy, and society to ensure peace, development, and population dignity. As we navigate global health challenges, solidarity and cooperation must guide our path forward to advancing our national health priorities. The Cambodia's WHO Country Cooperation Strategy 2024 to 2028, signed during our last regional committee meeting, mark a milestone in Cambodia's clear commitment to strengthening regional health outcomes. This partnership has driven significant reform, including our Health Strategic Plan 2025 to 2034 and 10-year Health Workforce Development Plan designed to improve the quality of health services toward universal health coverage by 2035. Cambodia is proud to demonstrate that innovation strengthens development boundary. The development of a digital health architecture, particularly for non-communicable diseases such as diabetes, hypertension, and cancer, are on the rise, strengthening our health system. Cambodia is confronting the NCD crisis through prevention, control, and management within primary healthcare. These include promoting healthy behavior, strengthening tobacco and alcohol control, and expanding mental health services. As a key to success, Cambodia has recently launched the National Cancer Control Plan 2025 to 2030. To realize health for all, we call for greater global equality in the face of disease risk. We require a more robust global regulatory framework with investment in primary healthcare, especially NCD prevention and care, stronger financial protection for vulnerable population, and enhanced health security cooperation. Cambodia recognizes the persistent challenges that confront us all, including climate change, demographic shift, and the rising burden of non-communicable diseases. However, we remain steadfast in our commitment to WHO's regional flagship initiative, ensuring that no one is left behind, as we weave the healthier and more resilient Western Pacific region together. Thank you.
Naka Okalewu, Cambodia. The next speaker is Hong Kong, Special Administrative Region, China, to be followed by Fiji.
Honorable Chair, Honorable Regional Director, Honorable Ministers, and distinguished fellow delegates, ladies and gentlemen. Hong Kong, China would like to congratulate the remarkable work and achievements of the Western Pacific Regional Office, as highlighted in Regional Director's report. The Weaving Health Together vision goes beyond reaffirming the direction of regional health collaboration. It translates this shared goal into concrete commitments to advancing well-being, and we deeply appreciate the WHO leadership in this aspect. We would also like to take the opportunity to thank the government of Fiji to host the meeting and also welcome Indonesia to join the W.H.O family. Hong Kong, China has long maintained a resilient public health system as reflected in our health outcomes. We have enjoyed one of the best health indices globally in terms of life expectancies, maternal and infant mortality rates, and so forth. These achievements stem from a solid health policy that no one should be denied medical care because of lack of means. Honorable Chair, we share the pains of the Regional Director that he mentioned in the opening speech this morning about the challenges faced by WHO, including the downsizing of organization due to financial difficulties. Rest assured that Hong Kong, China is committed to supporting global health, and we will contribute to capacity building by continuing to serve as WHO reference laboratories for several major diseases as well as pathogens, and as collaborating centers on tobacco control and traditional medicine. These platforms are testaments to our commitment to global health solidarity, and we stand ready to leverage our expertise through them to provide support to fellow member states in the region. That said, we also share many of the same challenges as fellow member states, such as the aging population, ongoing strain on health workforce, rise of NCDs and CDs, as well as rising healthcare expenditure and health disparities. So to tackle these challenges, Hong Kong, China is pressing ahead with targeted and far-reaching healthcare reforms. We are transforming our primary healthcare system from treatment-oriented to prevention-oriented, accelerating the responsible adoption of AI as well as digital health tools and smart tools to enhance the efficiency and reach of our services, enhancing tobacco control, enhancing mental health, and also taking forward several health promotion and disease prevention initiatives in a life course approach. Of utmost importance is our recent healthcare reform in incorporating our traditional Chinese medicine into the national healthcare system. Before end of this year, we will establish the first ever flagship Chinese medicine hospital as well as the government Chinese medicine testing institute. And we hope that this can strengthen further integrated health services and use traditional Chinese medicine as part of the solution to tackle the public health as well as medical problems. We would like to sincerely invite the regional director to join the opening of this event in December to witness the new chapter opening for Hong Kong, China. And we look forward to sharing our experience in this respect with the member states. Hong Kong, China fully supports W.H.O's visions and stands ready to deepen collaboration with fellow member states. We are committed to go far and go further. Together, we stand ready to work with the region to weave a more robust, equitable health ecosystem for all. Thank you.
Thank you, Hong Kong, China, and much appreciation on the integration of the traditional medicine. The next speaker is Fiji, to be followed by Australia.
Honorable Chair, Dr. Lalambalavu, the Regional Director, Dr. Piukala, Excellencies, heads of delegates that are here and those that are joining us virtually, Bula, and welcome to our home. On the outset, Fiji welcomes Indonesia as a new member of the Western Pacific region, RCM. I wish to add Fiji's voice in congratulating the Regional Director for his remarks and the comprehensive report provided to the last 12 months, for the last 12 months of the WHO Regional Office of the Western Pacific region. We thank the former chair and officers and warmly welcome the new chair and officers of the 76th RCM. Fiji is fully committed to the region's vision of weaving health for families, communities, and societies in the Western Pacific region 2025 to 2029. We are beginning to see and feel the changes through the commitment and real action as highlighted in the report. Fiji is prioritizing the review of its health-related legislation, which are a total of 6 legislations under review and 2 bills endorsed by Parliament for detailed vetting by the subcommittee. We are grateful to WHO for the support towards the review of the Mental Health Act. On preparedness and disaster response, we thank WHO for the recertification of FEMED as a WHO classified Type 1 fixed emergency medical team in May 2025. Fiji is now working towards the recertification of an added mobile capacity that will complement well our existing FEMED capabilities. Fiji remains committed to strengthening its primary health care approach with the support of WHO and our bilateral partners. We intend to improve primary health care services at all our primary health care facilities, working with our community counterparts and our more than 1,600 community health workers in the next 12 months. In December 2024, we launched Fiji investment case for tobacco control, and this has promoted our current effort to review our Tobacco Control Act 2010. This is an important step in updating our legislative framework to address the current challenges of electronic cigarettes, vaping, and other new forms of smoking and tobacco use. Fiji is committed to addressing climate change and health. At the COP29 meeting last year, we launched our National Adaptation Plan, which is a significant step in guiding our mitigation and adaptation efforts to address climate change impacts in health. We are facing a challenging outbreak of HIV in Fiji, and we acknowledge the support of WHO, UNAIDS, and many other partners in tackling the outbreak. We welcome you all to the side event on Wednesday, where we will share our story and hope to learn from yours. Fiji is focusing on strengthening women and children's health. This week we launched our new maternal and child health policy. Earlier this month, together with the Ministry of Women, Children and Social Protection, we launched Fiji's new National Child Safeguarding Policies with the protection of our children. I wish to conclude by adding my voice in thanking WHO and congratulating the 21 Pacific Islands and Japan for the elimination of measles and rubella in our countries. May this be a beginning of a mighty fight back by our Western Pacific region against infectious disease, giving our children and our people a brighter and a healthier future. Fiji invites WHO and our partners to support member states in addressing our health priorities in the next 12 months. And I thank you, Chair, for this opportunity.
Naka Viti. The next speaker is Australia, to be followed by China. The floor is yours.
Thank you, Chair, Regional Director, Excellencies and colleagues. Bula. I'm grateful to be here for my first RCM and have appreciated the warm welcome. I can see why our compassionate RD refers to the Western Pacific as family, woven together through close bonds and a collective desire to improve health and well-being and save lives in our region. I join others in thanking Fiji for hosting and an opportunity to experience true Pacific hospitality. I also welcome Indonesia and Minister Budi. My Minister, Mark Butler, sends his warm regards and apologies for not being able to make it. Australia thanks the RD and his team in the regional and country offices for their leadership and dedication to advancing health outcomes. We recognise ongoing challenges but assure you of Australia's steadfast support. We thank the RD for his report. The new format is a great example of improving transparency across the WHO, and Australia is pleased to see progress against tangible indicators and targets. We are conscious of what's ahead. It is fitting we meet in the Pacific, the front line of climate crisis. Australia is taking action to address climate change, combining domestic policy reform, international leadership and sector-specific strategies backed by clear emissions targets. Our actions through our Pacific Climate and Health Resilience Package are in lockstep with regional efforts towards mitigating the health impacts of climate change and reducing its impact on health systems. Australia is strongly committed to its COP31 bid in partnership with the Pacific. We look forward to continuing to work with our partners to collectively deliver outcomes for the world. Our region is particularly vulnerable to natural disasters and infectious disease outbreaks. Australia is committed to supporting our region to build more resilient health systems to be better prepared for and respond to these. The IHR amendments and pandemic agreement herald a new era for global health security. Australia is proud of the role we play in these and now in representing our region as Vice Chair of the Intergovernmental Working Group on the PABS Annex. Australia's Centre for Disease Control will strengthen our national capacity and readiness for future health risks. Anchored in a One Health approach, the CDC will also better position Australia to support regional partners. We welcome the UN 80 Reform Initiative as an opportunity for the WHO to reaffirm its place as a leader in global health. As member states, we can be the architects of the change we want to see. As Executive Board Chair, Australia continues to champion reforms. Australia thanks the RD for his collaboration with Member States on prioritisation and looks forward to continuing discussions. Australia's commitment to the multilateral system is enduring. It is important we reform to protect essential functions that only the multilateral system can provide, particularly the WHO's leadership in global health to deliver health for all. Thank you.
Thank you, Australia. The next speaker is China, to be followed by Mongolia.
谢谢主席。
Thank you, Chair. China appreciates the work report presented by RD and also the strong impetus Dr. Piukala has provided to health development in the region since assuming the role of regional director. This is our first statement. We thank Fiji for hosting this regional committee meeting and for its hospitality once we arrive at Nadi. We also sincerely congratulate Indonesia on joining the West Pacific region and look forward to continuing and deepening our health cooperation with Indonesia. We are very pleased to say that West Pacific region has established a transition team to develop and implement the vision for the next 5 years, building health for families, communities, and societies together in West Pacific region. We highly appreciate the efforts of the RD under Dr. Piukala's leadership in shaping workplace culture and fostering a harmonious environment. We are particularly grateful for the efforts of Dr. Piukala and the regional office in advancing health initiatives at the country level, continuously increasing budget allocations and enhancing the capacity of country offices. We commend the use of various mechanisms such as cabinet meetings and project management committees to further strengthen interaction and experience sharing between regional and country offices, including the rotation of country offices in these mechanisms. This fully reflects the country-centric approach, helping the regional office better understand the actual situations of member states, enhancing transparency, mutual trust, and boosting the confidence of national health departments and the regional office in working together. We especially thank the regional office for its support in improving China's long-term medical care, continuously refining medical security policies, and enhancing universal access to health services. Since the beginning of this year, the organization has faced significant funding challenges and has taken various measures to actively address them. China firmly supports WHO in playing a central coordinating role in global health governance. During the 78th WHO, Vice Premier Liu Guozhong announced that China will provide an additional $500 million in funding support over the next 5 years. China will also correspondingly increasing its financial and project support to this region. We call on all countries to join hands and increase their contribution to WHO to ensure the timely achievement of the 2030 Sustainable Development Agenda. China looks forward to the regional office in the process of advancing reforms, continuously enhancing the representation of personnel from countries within the region, and fully leverage the role of WHO collaborating centers in the region in global health governance and development. We also welcome all measures and efforts by the regional office to improve efficiency, increase project implementation, and enhance transparency and trust. We are willing to work together with membership and the regional office in this region to promote the smooth implementation of WHO's 14th General Program of Work and our vision, jointly weaving a healthier and a safer future, advancing the implementation of a global initiative on development, security, civilization, and governance, and building a global community of health for all. Thank you, Chair.
Thank you, China. The next speaker is Mongolia, to be followed by Cook Islands.
Thank you. Thank you, Chair. Chair, Regional Director, Dr. Piukala, Honorable Ministers, distinguished delegates, ladies and gentlemen. Mongolia commends the Secretariat for this comprehensive report, which captures the collective achievements and renewed spirit of solidarity in the Western Pacific region over the past year. We appreciate the strong leadership demonstrated in navigating change with transparency, compassion, and accountability, and in uniting member states under the shared vision of weaving the health for families, communities, and societies. We note with appreciation the region's tangible progress in the 5 key action areas, from transformative primary health care and resilient health systems, to climate action, digital innovation, and healthier lives across the life course. These efforts demonstrate how our region continues to lead through innovation, partnership, and people-centered approaches. In Mongolia, we have benefited greatly from W.H.O.'s support, particularly in integrating tuberculosis services into primary health care and aligning this work with our universal health coverage and social protection goals. This collaboration exemplifies how regional priorities translate into meaningful national results. We also acknowledge WHO's continued focus on climate-resilient health systems and emergency preparedness. For a country like Mongolia, where climate extremes and geographic challenges affect health equity, these areas of work are of particular importance. We look forward to further collaboration under the Alliance for Transformative Action on Climate and Health. Finally, we share the Regional Director's emphasis on digital transformation and innovation as enablers on health equity. Mongolia remains committed to advancing digital health solutions that connect even our most remote communities to essential health care. Mr. Chair, Mongolia reiterates its full support to the Regional Director's vision and commends the WHO's revitalized engagement with member states. We stand ready to continue working hand in hand with WHO and fellow member states to weave a stronger, fairer, and healthier Western Pacific region for all. Thank you very much.
Naka, Mongolia. Next speaker, Minister from Cook Islands, to be followed by Vietnam.
Thank you very much, Chair. Distinguished delegates, ladies and gentlemen, kia orana again and Bula vinaka. I would like to congratulate you again, our Regional Director, Dr. W.H.O, Piukala, for your excellent leadership for the Western Pacific region and all member states of our collective effort in advancing and weaving health for all across our region. I must acknowledge the hardworking Secretariat of the WHO behind this success, not forgetting the excellent and ongoing support from our WHO country and regional office, and many other development partners for our collective success. However, this success also comes at a cost and challenges in addressing communicable and non-communicable diseases, and the threats and risks of climate change and health emergencies across our region. Public health care system transformation and resilience strengthening is critical for equitable access for our people and communities. Workforce development, retention, and well-paid health workers is important to implement our transformation efforts. Technology system transformation, also very critical in the future of healthcare delivery across our remote islands. On that note, I would like to thank WHO and our other many development partners, UNICEF, UNDP, SPC, Polynesian Health Corridor with our New Zealand Ministry of Health, ADB, and many others for the technical and financial support to our nation, the Cook Islands, in the last year, which has enabled us to have the necessary policies and plans in place, such as, to name a few, the Joint External Evaluation Report, our National Action Plan on Health Securities, the recent rollout of our Healthy Islands initiative to our Northern Group Islands 2 weeks ago, and our baby-friendly hospital initiative, baby-friendly vaccination center, focusing on the first 1,000 days of a child and early childhood development. And also the soft launch of My Healthy Plate Nutrition app, the Manage My Health app, our primary health care role delineation policy, and many others. So once again, thank you very much, and I thank you, Chair.
Thank you, Minister Brown, for that speech. And the next speaker is Vietnam, to be followed by Malaysia.
Honorable Chair, Dr. Saia, Piukala, Regional Director for the Western Pacific, Honorable Mr. Ophan of Member State, distinguished delegates, ladies and gentlemen. I am pleased to join colleagues and friends from across the Western Pacific region here in Nadi, Fiji. In August, we was honored to welcome Dr. Saia to Vietnam. Like in his home country of Tonga and many of our countries, Vietnam faces ongoing risk from climate change-related disaster. During Dr. Saia's visit, Typhoon Kaziki struck and his witnessed firsthand the storm impact and the swift response from authority and community. He also visited a hospital where Fiji is working with W.H.O. to strengthen climate resilience and environmental sustainability. We are pleased that some of this work will be shared during this regional committee session. In Vietnam, we believe health is our most precious asset, the foundation for happiness and sustainable development. Protecting and improving people's health is a top national priority. This commitment was recently reinforced through Politburo Resolution 72, a breakthrough policy that outlines a roadmap forward free essential health care, including regular medical checkup for all. This year, Vietnam has taken bold steps to protect current and future generations. We issue a comprehensive ban on e-cigarette and heated tobacco products. The Minister of Health was recognized in a W.H.O. World No Tobacco Day Award in 2025 for her outstanding leadership and advocacy for the ban. We also reformed tobacco tax, an action projected to help 2.1 million people quit or avoid smoking by 2031, prevent 700,000 premature deaths, generate $910 million in revenue, and reduce use assets to low-cost cigarette brands. We are also proud of our progress in restoring and surpassing pre-pandemic vaccination rates. In 2024, Vietnam achieved 99% coverage for the first dose of the diphtheria, tetanus, and pertussis vaccine, up from 80% in 2023. This success reflects strong government leadership, dedicated hand worker, and community support. Looking ahead, Vietnam remains committed to working with W.H.O member states and partners to build a healthier, safer, and more resilient future for all. We are sincerely grateful for W.H.O dedicated support to Vietnam and the region. Thank you.
Thank you, Vietnam. Next speaker is a delegate from Malaysia, to be followed by Singapore.
Thank you, Chair, Regional Directors, Excellencies, and distinguished delegates. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. It is a privilege to address this regional committee on behalf of Malaysia. Allow me to begin by expressing our sincere appreciation to WHO for bringing us together at the 76th Regional Committee meeting, and to the government and people of Fiji for their warm hospitality and excellent arrangement. Malaysia also wish to welcome Indonesia, our close neighbors and friends, as part of W.H.O communities. Malaysia commends the Regional Director and his team for their leadership in advancing health initiative and weaving health priorities into a broader development agenda, resulting in a tangible improvement across the region. We note the key internal reforms, restructuring work streams, strengthening operation, and fostering a country-first mindset have enhanced the organization's responsiveness and effectiveness. Malaysia reiterates its strong commitment to implementing the revised internal health regulation, which entered into force on the 19th of September 2025. We are in the process of adapting our national system to align with these important reforms. We fully recognize the importance of the pandemic agreement and ongoing negotiation on the pandemic access and benefit sharing mechanism. Malaysia stresses that the PABX Annex must be grounded in equity, fairness, and full respect of national sovereignty. Malaysia remains a strong advocate for global action on lung health, having championed the Integrated Lung Health Resolution at the 78th World Health Assembly. With lung diseases still imposing a heavy burden exacerbated by tobacco use and environmental risks, we have scaled up preventive measures, including school-based education, mass media campaigns, and community outreach. These efforts, anchored in the whole of nation and regional spirits of cooperation, reflect our determination to achieve a smoke-free Malaysia by 2040. In the spirit of embracing digital innovation, we are pleased to share highlights of these efforts through an AI-narrated video available at the display area. Under the 13th Malaysian Plan, the health system reform agenda encompasses infrastructure strengthening, financing innovation, service integration, and digitalization, with a strong focus on reducing fragmentation and ensuring continuity of care. Key initiative includes the exploration of National Health Fund as a strategic mechanism to enhance resource pooling and procurement efficiency, as well as the introduction of a uniform, affordable, basic medical insurance and takaful product. Malaysia is driving reforms through the phased implementation of cloud-based electronic medical record system designed for large-scale adoption at high speed and low cost. This strategic initiative underpins the vision of one person, one record, ensuring that every citizen will have a lifetime health record accessible securely through the individual MySejahtera application as a national digital health gateway. Completing this reform, Malaysia also prioritizing mental health through the K Mindset program, a national initiative designed to enhance community leaders' literacy, reduce stigma, and expand access to psychosocial rehabilitation services. Aligned with the national mental health policy, this initiative underscores Malaysia's commitment to nurturing a resilient and a productive generation while positioning mental well-being as the central pillars of health system transformation. Excellencies, the progress we seek cannot be achieved in isolation. The Madani government of Malaysia remains steadfast in fostering partnership, working alongside policymakers, healthcare workers, civil society, and the private sector to ensure that no one is left behind in our pursuit of universal health coverage and the 2030 Sustainable Development Goals. Thank you, Chair.
Thank you, Malaysia. The next speaker is the delegate from Singapore, to be followed by Papua New Guinea.
Thank you, Chair. Singapore joins other member states in thanking Fiji for hosting RCM 76 and also welcoming Indonesia to the W.H.O family. Singapore would like to express our appreciation to Regional Director Dr. Piukala for his steady leadership in times of change and uncertainty. We also thank all W.H.O staff for the outstanding work done. The refreshed annual report highlights the significant achievements of member states over the past year as we work collectively towards our region's shared vision of weaving health for all. Guided by this vision, Singapore has made progress towards improving health and well-being of our people and will continue to do so with WHO's support. Allow me to share 3 points. First, Singapore has redoubled efforts to prevent and control non-communicable diseases, NCDs. In line with WHO recommended best buys, we have implemented multi-pronged interventions to address key NCD risk factors, such as tobacco use, alcohol consumption, poor dietary habits, and physical inactivity. With the rising NCD burden in our region, we must continue to reshape our norms and create supportive environments where individuals can make healthier choices. Second, we have strengthened our emergency preparedness and resilience. Beyond establishing Singapore's emergency medical team to provide rapid and effective medical support during local and international health emergencies, we have also established the Communicable Diseases Agency, CDA, our national public health authority, which oversees and provides end-to-end public functions from clinical policy making to disease response. Recognizing that combating communicable diseases is a shared responsibility, the CDA promotes public education and partnerships locally and internationally to strengthen collective resilience and ensure coordinated responses to outbreaks. Thirdly, through our national strategy, Healthier SG, primary care providers are empowered to make social prescriptions and recommend patients to participate in community activities and adopt healthier lifestyles. With the first WHO Collaborating Centre for Social Prescribing designated in Singapore last year, we look forward to collaborating with WHO and member states to explore how to better adopt social prescribing to enhance population health and well-being. As described by RD, this annual report is a tool to drive collective action towards our shared vision. As the global health landscape continues to evolve, Singapore will remain committed to partner W.H.O and fellow member states to accelerate progress towards a common goal of health for all. Thank you.
Thank you, Singapore. The next speaker is the delegate Minister from Papua New Guinea, to be followed by the Federated States of Micronesia.
Thank you, Chairperson, Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. Papua New Guinea commends the Regional Director for the strong leadership and the comprehensive report presented this morning, which reflects our region's collective achievements and shared commitment to advancing health for all under the For the Future towards the healthiest and safest region vision. We also take this opportunity to warmly welcome our closest neighbor, Indonesia, to its first session as part of the WHO Western Pacific Region Committee, and look forward to closer collaboration in advancing our common regional health priorities. Chair, Papua New Guinea acknowledges the World Health Organization's steadfast partnership in strengthening our national health system through the implementation of the National Health Plan 2021 to 2030 and the advancement of our universal health coverage roadmap, which is firmly embedded within the government's medium-term development plan number 4. This ensures that health remains central to our nation's development agenda and that every Papua New Guinean has equitable access to essential health services. We particularly value W.H.O.'s technical and operational support in our efforts to eliminate trachoma, a preventable cause of blindness, and building national laboratory capacity, including the training of PNC laboratory teams, to enhance diagnosis, surveillance, and preparedness for emerging health threats. As part of our continued commitment to public health, in May 2025 this year, the government took a decisive action to ban the sale of e-cigarettes in all its forms, making an important milestone to tobacco control among our young people. Papua New Guinea remains committed to the region's priorities, highlighted in the report, strengthening the One Health collaboration, building climate-resilient health systems, and promoting equity in health service delivery across all provinces. As we look ahead, we reaffirm our commitment to working closely with WHO and member states to advance universal health coverage, health security, and resilient health systems, ensuring that no one in our region is left behind. Thank you, Chair.
Thank you, Papua New Guinea. Next speaker is a delegate from the Federated States of Micronesia, to be followed by Indonesia.
Thank you. Honorable Chairperson, Honorable Regional Director, Ministers, distinguished delegates, ladies and gentlemen. Bula and a warm greeting of Ka Morale from the FSM. Let me first thank the Fiji delegation for the wonderful traditional welcome by the people and government of Fiji last night, especially with the presence of His Excellency Prime Minister. We congratulate the office bearers of this year's RCM. My delegation looks forward to working with you during the 76th RCM. FSM would like to extend its welcome to Indonesia for joining our Western Pacific family. Welcome, Indonesia. We congratulate the RD and the W.H.O Secretariat for the excellent report. The report is straightforward. It provides a balanced content on issues, challenges, and highlights of successes facing W.H.O in delivering results post-COVID and at a time of declining resources. Clearly, there are a lot more lessons learned, best practices, and stories from countries that cannot be covered in an annual report. We appreciate the active engagement of RD and your senior management team in the regional and sub-regional events. For us, specifically at the Micronesian Presidential Summit, where RD discussed health issues of regional significance with our leaders. The report also speaks to W.H.O's effort in strengthening country offices, building feasibility of the W.H.O in country, and advancing national priorities. FSM welcomes all these and looks forward to engaging more with the W.H.O. We're aligned with the weaving mat principle and support the proposed actions in the report. As a matter of fact, just 2 weeks ago, we used the same weaving mat analogy in our recently completed 10th FSM Women's Conference, basically focused on gender equity and equality. Once again, RD and Secretariat, thank you for an excellent report.
Thank you, FSM. Next speaker is Indonesia, delegate from Indonesia, to be followed by Tonga.
Thank you, Chair. Honorable Regional Director, Excellencies, ladies and gentlemen. On behalf of the Government of Indonesia, I extend our deep appreciation to the W.H.O Regional Office for the Western Pacific and all member states for the warm welcome extended to Indonesia as the newest member of this region. We also thank the Honorable Regional Director for his thoughtful and inspiring report. It reflects both the achievement we should be proud of and the challenges that continue to demand our shared attention. Indonesia stands ready to contribute to the collective efforts of advancing health and well-being for all people in the Western Pacific. As this is Indonesia's first participation in the regional committee as a W.H.O member, we are here to observe, listen, to learn and to collaborate. We are also encouraged by the region's strong focus on key indicators, such as universal health coverage, measles immunization, hypertension treatment, emergency preparedness, and NCD prevention. Indonesia shares this focus and is committed to advancing measurable progress across all five. Furthermore, we continue to advocate to strengthen multilateralism, especially in a fragmented geopolitical environment. We believe our collective strength lies in partnership. We are ready to support cross-country capacity building as we have done with Vanuatu and Fiji, because when you teach one person, you strengthen a whole community, and when you build one country's capacity, you uplift an entire region. Excellencies, as we move forward, let us remember a saying from Indonesia, berat sama dipikul, ringan sama dijinjing. When we carry burdens together, even the heaviest loads become lighter. May this spirit guide our collective journey toward a healthier, more resilient Western Pacific region. Thank you.
Thank you, Indonesia. The next speaker is the Minister from Tonga, to be followed by the United Kingdom.
Thank you, Honourable Chair, Regional Director, Health Ministers and Leaders for Health in the Western Pacific region. Tonga would like to thank Fiji for hosting the 76th of the Regional Committee meeting. Tonga acknowledged the continuing support and leadership of WHO to small island countries, particularly to small Pacific islands, including Tonga. Tonga commends the Regional WHO Office for the comprehensive report we heard this morning. Thank you for the leadership in ensuring that everyone, big, medium, and small, take the walk together. As we heard from the Regional Director this morning, if you want to walk fast, walk alone. If you want to walk far, walk together. I'd like to thank all of our development partners, Australia, New Zealand, Japan, China, Philippines, Korea, UN organizations, World Bank, ADB, and all stakeholders for taking the walk together with our small islands. This is the only way we can ensure universal health coverage for all is attained. The issue of climate resilience is a must for our small island states that are very vulnerable to climate change. I congratulate Fiji for their success in accessing funds for their health facility renewable energy. I believe Tonga will benefit from similar program to assist with relocating of our health facilities which are affected by the sea level rising and extreme weather events. Tonga continues to fight NCDs which are killing our people. We are committed to strengthening primary health care, as this is where we know we will be able to address the issues of poor health-seeking behavior, mistrust, and accessibility to health services. We are currently upgrading our health centers throughout Tonga to encourage people to use them to screen for NCDs in order to address them before complications happen. Our health workforce, however, remains challenging, with brain drain continuing. Once again, I thank you all for working together with our small islands. I believe that collaborations and weaving equitable health will build stronger health systems for all. Watu.
Thank you, Minister from the Kingdom of Tonga. Now I give the floor to the delegate from the United Kingdom of Great Britain and Northern Ireland.
Thank you, Chair. The United Kingdom is honoured to participate in this year's Regional Committee meeting and expresses its thanks to the Government of Fiji for their incredible hospitality. The United Kingdom commends the Regional Director for the ambitious vision laid out in the report, Weaving Health for Families, Communities and Societies. The metaphor of the woven mat, symbolising collective action, is a powerful reminder of the strength of regional solidarity and the importance of working together to improve health and save lives. The United Kingdom remains a committed partner to WHO globally and regionally. As the largest provider of flexible funding to WHO, we are proud to support the organisation's ability to respond rapidly to emerging health threats and to prioritise resources where they are most needed. This flexibility is vital to enabling WHO to deliver on its mandate effectively, including in the Western Pacific region. We strongly support WHO's prioritisation process and its longer-term transformation agenda, which we see as essential to strengthening the organisation's impact, transparency and accountability. We also welcome efforts to align these reforms with the broader UN 80 agenda, which calls for revitalised multilateralism and a more responsive, inclusive and effective global health architecture. The United Kingdom deeply values its partnerships across the Western Pacific. We recognise the unique challenges faced by countries and areas in the region, from geographic isolation to climate vulnerability, and we applaud the region's efforts to build resilient, inclusive and people-centred health systems. We look forward to continued collaboration with Member States and WHO to advance shared priorities and deliver meaningful health outcomes for all. Thank you.
Thank you, United Kingdom. Floor recognizes New Caledonia, France.
Mr. Chairman, New Caledonia thanks the Secretariat for its excellent report. We would like to congratulate Dr. Saia, the Regional Director, who I met in Tonga at the recent Pacific Health Ministers meeting in December 2020. Thank you to the government of Fiji through its minister, who showed their excellent Melanesian traditional hospitality and Pacific hospitality. Yeah, thank you, Indonesia, for coming into our regional family. New Caledonia has a high-performing health system offering high-level health care based on modern hospitals and a reformed social protection system. The reform went back to the 2000s. We have a unified health and maternity insurance scheme pursuing international health goals for all the people of New Caledonia. The New Caledonia health system was made more fragile recently because of various health challenges arising and increasing demands from the community touched by chronic diseases. And we are trying to develop hospital services. And recently our territory has become less attractive to medical and paramedical staff in recent years, especially in the Northern and Loyalty Islands provinces who now have less health resources available. We've adopted a strategic plan to reform our health system. Recently, this plan is called the Do-Camo, the Fulfilled Person Plan. And we know we have some reforms to conduct over 3 themes: reforming the economic model, introducing strong governance into the health system, and strengthening prevention efforts, topics which we will address over the days to come. The current crisis in New Caledonia since the insurrection that occurred in May 2024 has accentuated imbalances and the shortage of medical staff, leading to a significant degradation or a reduction in available health services. So we need to recruit staff, improve their training and strengthen the health system. These are major issues today for the future of New Caledonia, which at the same time needs to conduct the necessary structural reforms to ensure the sustainability of the health system and the social protection system in New Caledonia. Thank you.
New Caledonia. Are there any more representatives who wish to speak on this topic? If not, I understand that there is a representative of another UN agency who wishes to make a statement to the committee on this agenda item? It is my pleasure to ask the representative of UNAIDS to deliver a statement to the regional committee. I now call on the
Chairperson, the Honourable Minister Antonio Balabu, Dr. Saia, Piukala, the Regional Director, Honourable Ministers, ladies and gentlemen, Bula. May I open with gratitude to Dr. Saia for centering equity and resilience in the Western Pacific's health agenda. To tackle everything from communicable and non-communicable diseases to climate threats and other challenges, we must invest in services that reach everyone and adapt as conditions change. We know that the Western Pacific is capable of this. Your countries have not just achieved public health wins, but sustained them. 25 years ago, this region was certified polio-free. So I ask, a quarter of a century from now, what story will we tell about HIV? Will the dream of ending AIDS by 2030 be realised, or will it fail at the foot of funding cuts and complacency? Esteemed delegates, today the region's HIV response faces a double stress test. Epidemics are growing while donor investments fall. As Dr. Saia said yesterday in our opening ceremonies, new infections are rising in Fiji, Laos, PDR, Papua New Guinea and the Philippines. Both of us share the concern that the sharp increase and potential for wider Pacific spread, which 30 years ago was the concern and never realised, but today is very much a potential. But although we know what to do, our efforts are not meeting the moment. Just when targeted prevention programs for communities are most needed, support is dwindling, and some countries report less than half of the people living with HIV are accessing antiretroviral therapy today. This undercuts prevention and costs lives. With rising infections, low treatment coverage, and declining external support and slow domestic investment, this could form the perfect storm that derails the goal of ending AIDS. We endorse Dr. Saia's call for stronger integrated services that advance multiple agendas, the realities of challenges today for all the health systems. Modern HIV programs should not be siloed. Let primary health care be our engine and universal health coverage our destination. I urge the region to protect and grow domestic financing with a focus on prevention and community-led delivery. Communities build trust and close the gaps where pandemics thrive, as we saw through COVID. This is how we respond to the lived realities of all people, especially the most marginalised in our societies. At the same time, we call on partners within and outside the region to share know-how and technical expertise and resources with countries under strain. On this note, we also acknowledge the support of Australia, France, China, Japan, New Zealand and Cambodia in this regard. Excellencies, we look forward to continued strong collaboration with WHO and member states across the region. I urge you not to lower expectations or postpone goals for the HIV response. Let us use this moment to re-energise and reimagine, and the leadership of the regional director in his statements about this issue reminds us that we must work to finish the work on existing pandemics while preparing for those to come. As our Goodwill Ambassador and former President of Fiji, W.H.O, says, let's keep our eye on the ball to achieve the goal. Bula.
Thank you for that statement, UNAIDS representative. May I now call on the regional director to respond to the points that have been made here today.
Excellencies, distinguished delegates, colleagues, I wish to express my sincere appreciation to all our member states for your thoughtful interventions and unwavering support for the Regional Director's report. But first, I thank you all for the warm welcome to Indonesia. When I started the ALDI report, I said, if you want to go fast, go alone. If you want to go far, go together. But it seems we are going together, and we are also going fast. Please slow down, member states. Your collective endorsement of our shared priorities, strengthening the health and care workforce, advancing climate resilient health systems, improving and sharing laboratory capacities, expanding immunization coverage, digital health, NCETs, IHR, and other priorities reaffirms our united commitment to health for all in the Western Pacific region. Your support for the health and care workforce agenda, especially in the context of climate change, is deeply valued. As highlighted during COP29 and recent consultation, building a resilient workforce is essential to safeguarding communities against the growing health impact of climate change. The emphasis on strategic investment and multi-sectoral collaboration will be critical as we move forward. On climate change, I welcome the strong calls to accelerate implementation of the Global Plan of Action and to mainstream health in climate negotiation. The leadership shown by member states in advocating for expert dialogues and integrating health into adaptation frameworks is a powerful signal of our region's resolve. Your commitment to immunization, as reflected in the Regional Immunization Agenda 2030 and recent country-level efforts, is a cornerstone of our public health strategy. We must continue to work together to reach zero-dose children and strengthen primary healthcare systems. I also acknowledge the support for laboratory systems and surveillance capacities, which underpin our ability to detect and respond to health threats. These investments are vital for preparedness and resilience. Finally, I am heartened by the spirit of solidarity and shared purpose that has defined our discussion. The intervention made by member states reflect not only alignment with the regional director's vision, but also a deep commitment to collaborative action. Together, we are weaving a future where health systems are stronger, communities are safer, and no one is left behind. Indeed, we are moving together, and yes, we are going faster. Thank you to our member states, honorable ministers, for your continuous support, partnership, and your leadership. Vinaka Vakalevu.
Thank you, RD Dr. Piukala, for those comments in response to the points and the comments that have been made from member countries' delegates today. It's now time for coffee break. Plenary session will reconvene at 3:45. Thank you very much. Bula Vinaka once again. Welcome back. So we will now move on to a mobility break. And may I ask everyone in a while to be upstanding for this mobility break. And leading the mobility break will be Mr. Luque. He's one of our liaison officer. And my profession is a dietitian, so he looks after the space of our NCD program here as well. So everyone, let's be upstanding in preparation for the mobility break.
Bula Vinaka. Oh, come on. I'm sure you can do better than that. Bula Vinaka. Right. This video was part of the Let's Move Fiji. It was created 10 years back. It was one of the strategic action towards the result of the WHO NCD step survey that revealed that Fijians were very inactive. So this video was created to show that it's easy, it's fun, and one of the best things is that it is quite inclusive. So it includes all age group, even disabled people can also follow it at home. So are you ready? Please set your eyes on the screen. Can you play the video, please? Sit.
Thank you very much, Luke. And now we move to agenda item number 8 on the program budget. You should have before you documents WPR/R76/3 and R76/INF/1 program budget 2024 to 2025. Budget performance, an interim report, and program budget 2026 to 2027, respectively. May I now request Dr. Susan Mercado, Director, Program Management, to introduce these agenda items.
Thank you very much, Chair. I'm pleased to present document RC76/3, which includes agenda item 8.1, offering an interim report on performance and utilization of the program budget for 2024-2025. And the second one is on item 8.2 on program budget 2026-2027. Now, you will note that these are two separate documents, and the text is quite dense, but later I will try to do my best to make the presentation as concise as possible. The two items are taken together, so there will be a presentation from headquarters, and I will also make a presentation, and the period of comments and questions will also be taken together. The first item, the interim report, focuses on performance and utilization of program 2024-25, and it's called interim because the year 2025 is not yet over. That covers the 1st of January 2024 up to June 2025, and in some instances we are referring to expenditures up to September 30 of 2025. All internal and external audit recommendations have been considered during this time period. So we have had a series of audits, and these have all been fully implemented or are proposed for closure, including the latest audit report on the Office of the WHO representative in Mongolia that was issued in August 2025. This demonstrates our very strong commitment to transparency, accountability, and the effective use of resources. The Secretariat continues to review and improve controls. We do have a network of program management officers in all budget centers who meet regularly. We have a regular program committee that also reviews all budget matters, expenditures, utilization. And we are also engaged with strengthening management, capacity building, and training activities. We also include improved communication, and we have a project management group that looks at larger donor funds and the monitoring of high-risk exposure transactions. The annex of the interim report on program budget 2024-2025 contains achievements against expected results over the first year of that biennium. Further information can be accessed at the Western Pacific Region webpage of our 2024 results report, and the link is provided within the document. The second part of this agenda item, or 8.2, focuses on the program budget for the next biennium, 2026-2027, that was approved by the World Health Assembly in May this year, and I will elaborate on that a little bit. This year, 33 million of the base program segment was shifted from the Southeast Asia region to the Western Pacific region due to the reassignment of Indonesia. So the total base budget allocation to the Western Pacific region is now $380.6 million US. In the Western Pacific region, the regional office and country offices work together to review and identify priorities, reflecting a reduced budget, resource constraints, and shifting priorities in countries. At that time, when we heard about the US withdrawal, we created 8 task forces comprised of senior managers, both from the regional office and from the country offices, to undertake the reprioritization, and reprioritization was based mainly on country priorities. There are 11 high-priority program budget technical outputs that further guided the allocation of 70% of the budget for the regional office. And again, I will elaborate for that in a moment. I'd also like to draw your attention to this document, which may be in front of you, which is called Weaving Health for Families, Communities, and Societies in the Western Pacific together. So there's more detail here for your use. So with your agreement, Mr. Chair, I would like now to invite our colleague in headquarters, Mr. Imre Holo, the Director of Strategic Planning and Budget from W.H.O. in Geneva, who has joined us virtually to make the global presentation, and I will follow with the presentation on the regional office. Good morning, Imre.
Good morning, Susie. How are you? Good morning.
Please take the floor. So the RCM is here waiting for you. Go ahead.
Thank you very much. And first of all, I would like to say that I would have loved to be there with you, but it's been very difficult to find the resources and justify for this trip. But I will do my best, and I hope that we will have better times that I can join you at your next meeting. Next time, please. Next slide, please. So just going into 26-27 program budget, I just would like to give you the context that you probably know, that as Dr. Susie said, the program budget was approved in May at the World Health Assembly for 26-27, and this program budget was 4.2 billion. That's the last blue part that you see on the right. That's the base part of the program budget. But when we came and presented the program budget 1 year ago in Manila, that program budget was 5.3 billion. And basically all the discussions and all the events that unfolded basically since last October, November, and specifically with the withdrawal of the United States, or the announcement of the intended withdrawal of the United States in January, the program budget was subsequently decreased by 4.2 billion. It's important to note that the discussions at that time with the member states and with the DG was that we're not reducing it to 4.2 billion only because of one donor. The reason was also because the whole financing landscape changed significantly at the beginning of this year, where ODA was predicted, and unfortunately we were correct, to decrease significantly, and particularly resources for health and health investments and health development will also decrease with that. So this sharp decrease of the program budget compared to the originally proposed was a result of basically trying to fit to the new realities. This is also not only a decrease compared to the originally proposed 5.3 billion. It was also a decrease from the current program budget, which currently is at 5 billion. So we went basically from 5 billion to 4.2 as part of this whole realignment. Next one, please. And this is just, again, another reminder that then we broke it down to major offices, and the overriding objective was to try to preserve regional offices and particularly country offices as much as possible, and to take a bigger decrease in headquarters. And in the end, this resulted in a 14% decrease of the budget, 14-15% in different major offices, looking at different elements that drove the decrease, and 23% in headquarters. So the headquarters budget was decreased by much more than, for example, in W.H.O. Next one, please. Then the big question was, how do we do that? We can't simply just cut the budget without rethinking what it is that we're doing. And we had several discussions with member states, and member states said that the biggest risk of decreasing the budget is doing everything but a little bit less of. And they said, they really urged us to do prioritization and to really think through what it is that we're doing instead of just doing a haircut of a little bit of less of everything. And the whole organization, including the Western Pacific region, went through a very rigorous prioritization process where we really try to identify what are the essential programs and essential activities that need to be preserved, rain or shine. What are the elements that are important but could be scaled back, and what are the elements that we should sunset or stop. And as we were doing that, we were asking questions about WHO's unique comparative advantage. What did the member states asked us to do? What are the mandates? What are the resolutions? What are the decisions? We also looked at the results of country prioritization. And basically, every team and every department in the whole organization had to come up with these priority 1, priority 2, and priority 3 areas. That was the basis for all the discussions and all the HR actions that followed. Next one, please. I'm not going to go into details about this, but this is part of the program budget discussion, or this is part of the program budget document that was adopted. We really try to identify what are the key main areas that we preserve. And obviously, this is the leadership in norms and standards, the convening function, global public health goods, capacity building, data monitoring, vaccines, medicines, and diagnostics, the health security infrastructure, research agenda, digital technology, basically fostering the science ecosystem, health equity, prevention of sexual exploitation, abuse, and harassment, workforce, and sound financial management and governance and transparency. So these are sort of the big headlines, and underneath the activities that form part of the budget. Next one, please. And these are just illustrative examples of what are the areas that we decided to scale back or drop. And here, I always say that it's very difficult to look at big headlines where we say that WHO is not going to do AMR or WHO is not going to do NCDs. That is not the case. The elements that we drop and scale back are much more nuanced. For example, on norms and guidelines, we decided to really focus on high impact normative products and reduce them, but of course not to completely stop them. We looked at duplication across the organization and among country offices, regional offices, and headquarters as well, and try to really focus on the activities in each area where we have the best value added. And basically, there's a number of elements that are scaled back, and the overall arching objective is really to try to focus on high impact and high priority areas. Next one, please. Going now into 26-27, one of the issues is, of course, the financial situation, and what is the expected financing available for that 4.2 billion. So first of all, and this is very, very important, that because of your support and your decision, the assessed contribution was increased by 20% again in compared to 24-25 in 26-27. And this has been an extremely important and necessary prerequisite for us to be able to preserve our work program as much as possible, despite all this financial and economic headwind. So when I'm looking at now the resources, that AC, which is now the increased AC, but without not counting the United States and Argentina's contribution, is now 1 billion. But this would have been much less if it not had been for your support, and that's of course our lifeline. Then we look at some estimated carry forward. So this is the amounts that we that we know we will be able to use. These are donor agreements that span beyond just 2025. This is again an estimated number, and it keeps on changing, but right now it's around 200 million. We have signed agreements of 460 million. And then we have late stage 678 million in early stage volunteer contributions. So altogether, that leaves a gap of 1.3 billion for the next biennium, which is much less than what we presented in May at the World Health Assembly. At that time, it was 1.7 billion. And by August, when we had the member state briefing, it was 1.4 billion. So that we're cautiously optimistic, but 1.3 billion is still a large sum that we need to fundraise. And we know that the financial situation is worse. So it's a little bit glass half full, glass half empty. There's very positive signs, and in normal times, this would not be a problem that we would be very certain that we would be able to fundraise. We will have to see how the next months and the year will develop, but we're cautiously optimistic that we will be able to fully fund the program budget 26-27, and that means also that we will be able to live up to our commitments that we have made to you, to the countries, and to implement the programs. Next one, please. And this is my last slide. Sorry, this is my last slide. I'll be very quick. Just to say that we have been looking at financial sustainability for the next biennium, and maybe the most important element of this slide, set of slides that show how we're going to fit within the new budget after the reprioritization is everything, is of course the reduction of the staffing component, which is an important component. And you will see that in the middle graph, the planned staff costs basically decrease from 2.682, so almost $2.7 billion, to 2.2 billion, which is more than $400 million. And that meant the departure and the reduction of the staff force, and that meant, of course, also the departure of many of our colleagues who basically were served notices as part of this prioritization process. And the most important element of that was that we have to have a footprint that is adequate or equivalent for that $4.2 billion, but is also in line with how much fundraising we can get in this current environment. With that, I give back the floor to you, Susie. Thank you.
Thank you so much, Imre, and we hope you. Thank you so much, Imre, and we hope you can be around to answer any additional questions we have after this. So allow me to present the program budget for the Western Pacific region. Next slide, please. So we are looking at 3 years here. The first set of 3 graphs is program budget 22-23. The middle one is 24-25, and the one at the end with the pink one is for 26-27. Now, if we ask the question, what is the approved base program budget? For those who are new in WHO, the program approved base program budget is a ceiling. It is the amount of money that we can spend if we're able to raise that amount of money. So for 2024-25, which is the biennium under review in the first document, the approved base was 408.1. If you compare that to the previous biennium of 2022-23, that is slightly higher than the previous biennium. And when we look at what the plan is for 2026-27, you'll see that there is a cut or there is a decline in that amount. Now, the 2 orange bars represent available resources. What was the amount of money that we were able to raise within that ceiling? And so for 2022-23, you will see that it was 66% of the program base, which was $268.1 million. For 2024-25, we raised more. So this is as of September this year, we raised $308 million. Now, the green bars beside these two represent utilization. Of the money that you have, how much are you able to spend? So in 22-23, we spent 92%. Currently, September 2025, we have spent 87% of the available funds. But we project that by the end of the year, the expenditure will be 96% or $295 million. Moving now to 2026-27, we see that we have a lower program budget at 380.6. And the projected funds that we know right now that could come in would be 307 million. Now there's a little dotted white line there that represents the addition of the budgets for Indonesia. Okay, let's go to the next slide, please. Okay, in this slide, we try to answer the question, what was the impact of the U.S. withdrawal on the Western Pacific region for our funding for 2024-25? And as mentioned in the previous slide, the approved base budget for 24-25 was 408.1 million. Now, the projected financing before the U.S. withdrawal, so that was like about the end of 2024, was 324 million. Currently, the actual financing that's available is 299. So there is 25 million that we lost with the U.S. withdrawal. Now, the next slide, I will speak a bit to the issue on human resources. And let's go to the next slide, please. So one of the things that W.H.O has been good at is that it has not had very dramatic increases in the staff number over, how many years is this? 10 years. So you will see that in 2013, the total number of staff was 653. And at the end of 2024, it was 680. So there's some marginal increase in the number of staff, unlike other offices where staff may have increased by 200 or 300. Within WIPRO, the average change is probably 10 to 20 staff every year. Now, the fluke, of course, is 2021, 2022, which was the COVID period, during which time many staff decided not to be deployed to other countries, and therefore we had a smaller number of staff. So what this is saying is that our changes or our shift, although painful to some extent, we've had to let go of some staff, has been minimal. The cut has been minimal because the changes over time have also been minimal. In short, we have been living within a sustainable budget over the past 10 years. Let's go to the next slide, please. So this is what it looks like in terms of funding for human resources. For 24-25, it is 213 million. And for 26-27, it will be only $193 million. Now, the next slide, which has a little bit more detail, is just saying that we have, sorry, not the next slide, the next graph on the right side, sorry about that. The next graph on the right side is just showing that we started off with many positions. So 107 positions, many of which were never filled. So over a period of time, we have been accumulating posts that are not funded and cannot be filled. So what we've done recently is we have abolished about 329 positions. Next slide, please. Okay, so this is about the sustainability for 2026-27 that Imre has referred to. So let's go to the budget, which is $380.6 million for the next biennium. Of that, we expect to raise $306.2 million, which means we need more help in terms of additional voluntary contributions and additional support for programs that have been hit by that 25 million cut from the withdrawal of the United States. And the most important programs to fund are immunization and communicable disease control. So we can see here that we have flexible funds. On the right side, you'll see a darker blue with projected flexible funds that comes from the money of the organization, from the assessed contributions, which is $171 million. Our projected voluntary contribution is $51 million. And what we are going to be proposing and what we have in the pipeline is 84, is this 84? Sorry. Okay. 84%, for 84. So this is the, how we see it. And it does mean that a big effort on resource mobilization is still needed for the region. Next slide, please. All right, and this is the last slide, on the second to the last slide. And it speaks to how we have been shifting the budget from regional allocation to country allocation. So in program budget 24-25, you'll see that 62% went to the country offices and 38% went to the regional office. For 2026-27, we have less funding at 381.6 million. And to the country office, it will now represent 68%, and regional office will be 32%. The objective, of course, is to move country office resources to 70% of the total budget and 30% for the regional office. So we're getting there slowly, and I think this particular exercise has helped us get to that point. Next slide, please. You're very familiar with this, but I'll just walk through it quickly. Imre had mentioned phase 1, phase 2, phase 3. What we did in the region was we had a committee that was made up of senior managers, both from regional office and country office, and we looked at what are the country priorities. And when we looked at that, we came out with these 11 general program of work, 14 outputs that were prioritized across the board. So these include climate resilient health systems and One Health, addressing the risk factors for communicable disease and non-communicable disease, people-centered service delivery, workforce development, product quality assurance, health information systems including digital health, non-communicable disease management and the best buys, delivery of communicable disease services, quality immunization services, national preparedness and readiness plans, surveillance and laboratories. And we've mapped this against the 5 regional priorities we have for weaving health for all. So these actually come out of a larger set of about 30 outputs that we are considering in the global program of work. For the country budgets, 70% of their budgets go into these 11 priorities, and 30% go to very context-specific needs of the member states. So there is some flexibility. I think I will end my presentation there. We do have, I do have with me the Director for Administration and Finance, Tamash, our Budget Finance Officer, Arpit, and our Program Development Officer, Atul. And I think Imre is still there. So we'll do our best to answer your questions. Thank you very much, Mr. Chair.
Thank you very much, Dr. Susan, for that very, very informative presentation from yourself and our representatives in Geneva. And we will now hear from representatives who wish to speak on these items, with a reminder that the interventions on the items 8.1 and 8.2 should be combined. I repeat, a reminder that interventions on 8.1 and 8.2 should be combined. Please indicate your wish to speak by clicking on the button on your microphone. Thank you. Call on the representatives of the Philippines, to be followed by Vietnam.
Good afternoon, everyone, and thank you, Mr. Chair. The Philippines appreciates the report for the 2024-2025 program budget, noting that this is the last biennial budget formulated under the global WHO GPW 13. The Philippines further notes that the transition to align WHO work with the 14th GPW or GPW 14 began in 2024, shifting efforts and budget reprioritization to the 5 strands of the regional vision. While the funding status for the 2024-2025 budget seems relatively strong, with a higher percentage of base segment funded, the continued heavy reliance on earmarked voluntary contributions created substantial challenges, thereby limiting the region's capacity to direct resources toward underfunded areas and therefore hindering efforts to achieve more equitable financial distribution. The Philippines acknowledges the significant challenge of formulating the program budget 2026-2027 amid reduced assessed contributions, necessitating a strategic recalibration of expenditures to ensure the sustained availability of critical resources. The Philippines supports the increased budget ratio in favor of the country office, ensuring the delivery of results with efficiency and impact, while aligning available resources to the 11 high-priority technical outputs aligned with the regional vision and in keeping with the shifting country contributions and positions. Finally, the Philippines remains faithful to our pledges in the previous regional meeting investment round to help channel resources towards our common health goals. Thank you.
Thank you. I call on the representative of Mongolia to be followed by Japan.
Thank you, Mr. Chair. Mongolia commends the Secretariat for the comprehensive and forward-looking report. We note with appreciation the strong financial discipline and transparent management of the program budget 2024 and 2025, despite global funding constraints, and commend the WHO's continued focus on country-level impact. Mongolia welcomes the region's clear focus on transformative primary health care, climate-resilient systems, and digital innovation. These priorities resonate deeply with our national context. Furthermore, we appreciate WHO's sustained collaboration in strengthening health financing, data systems, and accountability mechanisms, areas that directly enhance the sustainability of national health reforms. We also appreciate WHO's continued collaboration on non-communicable diseases, antimicrobial resistance, and cancer control, including through the Global Initiative for Childhood Cancer and the growing attention to health workforce strengthening. As Mongolia faces climate-related health challenges and workforce gaps, we are encouraged by the new program budget 2026 and 2027, particularly the focus on climate-resilient health systems, people-centered service delivery, digital transformation, and preparedness for health emergencies. Thank you very much.
Thank you. I call on the representative of Japan to be followed by Australia.
Thank you, Chair. We appreciate the Secretariat's report on the implementation status of the 24-25 budget and also the proposed budget 26-27. As for the implementation status of the 24-25 budget, we'd like to raise 3 points for inquiry and comments. First, regarding the utilization rate, we'd like the Secretariat to clarify the timeline of budget execution. In particular, we are aware of cases where country offices were unable to fully utilize donor-funded contributions, resulting in refunds to the donor. Such situations may affect our confidence in WHO. If the situation remains the same, it could become increasingly difficult for donors to justify increasing or keeping the financial contribution to the WHO. Second, concerning the funding gap shown in Table 2, while many strategic priorities and outcomes face funding shortages, we have observed that certain items have been allocated more than the approved budget. We would appreciate an explanation for this treatment. Third, regarding the staffing, thank you for providing more detailed staffing numbers. We understand that W.H.O has traditionally maintained a restrained staffing structure. We request the Secretariat to provide documentation showing the number of posts and their fulfillment rate by department before and after the recent restructuring. And as for the proposed budget 26-27, while assessed contributions have increased, the overall base budget have been approved in WHO with the reduction of 20%. In this context, it is essential to utilize the limited resources efficiently with the aim of realization of both GPW14 and UPRO's regional vision. As for the 26-27 proposal, I would like to raise 2 points. First, considering the budget allocation process, including selecting 11 high-priority program budget technical outputs, we would appreciate a breakdown of proposed budget allocation by department within the WIPRO Secretariat. Japan strongly encourages prioritizing allocation to technical departments to ensure that as much funding as possible is directed toward technical support. Second, I would like to understand what level of improvement in health indicators is expected as a result of this budget allocation. We understand that the progress report will be issued in 2 years, aligned with the results framework of GPW14. Setting clear targets at the time of budget formulation is critically important. Japan remains committed to working with the Secretariat and the Member States to address health challenges in the Western Pacific region while continuing to support prioritization process, enhancing transparency and efficiency. I thank you, Chair.
Thank you, Japan. I call on the representative of Australia to be followed by New Zealand.
Australia thanks the Regional Office for both budget papers and the consultation undertaken with regards to reprioritisation. We welcome the redistribution of budget allocations from the Regional Office to the Country Office, demonstrating the importance of ensuring funds are directly in country. We are confident the approach will drive improvements to both country and regional health outcomes. Specifically, the significant investment in non-communicable diseases is appreciated. We recognise this is a difficult time and staff in all offices have shown great resilience and commitment in working through difficult prioritisation discussions. Australia recognises that difficult decisions on core activities and programs will continue to be made as we progress on the prioritisation journey. We appreciate the need to engage with challenges and discuss among regional member states how the workers in the region will change. Australia is seeking additional details on the following. Firstly, we know priorities have been appropriately funded. What isn't as clear is how the quantum of funds has been allocated to those priorities ranked highest through consultation with member states on prioritisation. While Australia accepts the financial allocations, we would appreciate greater detail on the methodology. As part of this, we would also like to understand what level of support is expected to be provided to sexual and reproductive health and rights within the region for the 26-27 biennium. Secondly, we would be interested in receiving greater detail on how the budget allocations will be operationalised. It is unclear from the paper if the WHO is confident in being able to deliver on activities to service the allocations, particularly noting staffing constraints. Thirdly, we are keen to understand what risks and roadblocks exist for country and regional officers in the operationalisation of the budget. We note the poor utilisation rates in relation to the WHO's budget in 24-25. While we recognise there are reasons behind these rates, it is of concern that we are now expecting implementation against a new general work programme of work in the context of significant reprioritisation. We're keen to understand if there are workforce shortages, capacity and capability issues, or other related challenges that are fundamentally risking operationalisation of both the budget and the prioritisation process. Finally, we would like to ask the Secretary to clarify what engagement there has been across the regional and country offices and with other delivery partners on the shift of services and functions to match activity to the prioritisation being proposed. Thank you.
I call on the representative of New Zealand to be followed by China.
Thank you, Chair. New Zealand commends the Regional Director and the WHO Western Pacific Regional Office for the leadership and resilience demonstrated during a time of global and economic uncertainty. We welcome the reprioritisation of resources outlined in the programme budget interim report, and we acknowledge the challenges posed by constrained funding. We particularly support the emphasis on strengthening country capacity, improving transparency and aligning resources with measurable impact, and echo the comments from the Australian representative in relation to ensuring that the funds going to country capacity are matched with the ability to deliver. By utilising its strengthened monitoring, impact measurement and evaluation tools, WHO will be better positioned to track progress and achieve results. And we want to make sure that there is clear targets in place to ensure that the money where it's been allocated achieves demonstrable impacts. We welcome the focus on strengthening primary healthcare as the foundation of resilient health systems as highlighted in the 26-27 program budget. We also welcome the commitment to integrating digital innovation into frontline services to ensure that remote communities can access timely quality care. New Zealand reaffirms its commitment to regional solidarity. We will continue to work alongside WHO and our Pacific neighbours to strengthen emergency preparedness, tackle non-communicable diseases, and build the resilient health systems that we need. Thank you.
Thank you. I call on the representative of China to be followed by Fiji.
China thanks the Secretariat for the report on the midterm implementation of the 2024-25 program budget and the introduction to the development of the 2026-27 program budget. China notes that compared to the previous biennium, funding for all pillars in the region has increased during the 2024-25 period, and the budget implementation progress is satisfactory, which we appreciate. China takes note of the documents mentioned that the Audit Department found the South Pacific Rep Office requires a significant improvement. Also notes that the residual risk level issues in the internal control testing for the regional office, administration, and the finance department, as well as the Mongolia and the Philippines country office. We hope that the Rep Office can share the specific issues raised by the Audit Department and propose corrective measures. China believes it is essential to enhance transparency and accountability in project implementation. The organization faces significant funding challenges and has adopted measures such as reducing the budget size, identifying key priorities, restructuring and downsizing staff to address them. Our region faces similar challenges. China commends the efforts of Dr. Piukala and the regional office in mitigating the impact on the region. China hopes that staff reductions will not disproportionately affect WHO staff from underrepresented countries, thereby worsening their underrepresentation. We also request the Secretariat to take further measures to enhance the representation of these countries. China is pleased to say that although the overall program budget for the 2026-27 biennium has decreased, the proportion allocated to country offices has increased. This reflects the organization's shift towards a country-centric approach. We note and welcome the 11 priority areas identified by the Secretariat. We hope that relevant country office can promptly initiate communication with their host countries to confirm the implementation plans and the specific pathways for achieving these 11 priorities indicators to enable member states to more effectively support the region's work. China supports WHO's coordinated role in global health governance. Despite China's own fiscal constraints, at 2025, WHO will announce support for an increase in WHO assessed contributions, aiming for them to constitute 50% of the base budget by 2030. In this way, the organization can access more stable and flexible funding to better support member states, especially developing countries. As the current largest contributor of assessed contribution to WHO, the increase has the most significant financial impact on China, making this commitment particularly challenging for us. Meanwhile, China will continue to increase its support to the organization through increased voluntary contribution, project support, and other funding inputs. China also calls on all countries to increase their financial support to W.H.O, especially to regional office, to ensure the timely achievement of health-related 2030 Sustainable Development Goals, and jointly with health for the globe and for our region. Thank you.
Call on the representative for Fiji to be followed by Vietnam.
Thank you, Honorable Chair, distinguished members. Fiji extends its sincere appreciation to the Secretariat for the preparation of the interim report on the program budget utilization for 2024 and 2025. We note that the overall budget utilization of 69.4% as at 30th June 2025, and commend the Secretariat for its continued effort in managing resources effectively. We further encourage the Secretariat to ensure full and timely utilization of available funds to maximize impact and strengthen country-level support to member states. Fiji acknowledges the ongoing challenges resulting from the reduction in the baseline budget allocation to the regional office, particularly the difficult decisions involving dedicated staff who have faithfully served in advancing the region's health priorities. Regarding the proposed 2026 and 2027 program budget, Fiji recognized the complex and rapidly evolving global financing environment. We stand in solidarity with the WHO in its commitment, safeguarding essential health programs and ensuring that priority health concerns across the Pacific are adequately supported through sustained technical and programmatic assistance. Fiji wholeheartedly appreciates and having full confidence in the Secretariat's leadership and wisdom in guiding the Western Pacific region towards a professional, equitable, and sustainable path in achieving our collective health goals. Nawale.
Call on the representative of Vietnam to be followed by the Republic of Korea.
Thank you, Chair. Vietnam would like to express the deep appreciation to WHO and partners for their continued technical and financial support in strengthening Vietnam's health system. In the millennium 2024-2025, with WHO's cooperation, Vietnam has made notable progress. Primary health care models piloted in Ho Chi Minh City have improved access to services for hypertension and diabetes patients and are now being scaled up nationwide. We are grateful for WHO's support in revising the health insurance law to advance universal health coverage, as well as in enforcing a comprehensive ban on e-cigarettes and heated tobacco products. We also value WHO's assistance in controlling infectious diseases, elimination trachoma, reducing malaria, and responding to public health emergencies such as Typhoon Yagi in 2024. Cooperation on climate-resilient health facilities, antimicrobial resistance, and digital health has further strengthened our preparedness and resilience. Vietnam welcomes the draft program budget 2026-2027 and appreciates WHO's strong commitment to advancing equity, resilience of health systems, and preparedness for health emergencies. We noted that the program budget 2026-2027 reflects a more realistic allocation of resources, balancing between global, regional, and country-level needs, while expanding thematic funding to enhance flexibility and accelerate implementation. The Ministry of Health of Vietnam values this approach, which enable WHOs to better align with national priorities and provide timely technical cooperation to member states. We sincerely thank WHO and development partners for their valuable assistance and look forward to further fruitful collaboration. Thank you.
I call on the representative of Republic of Korea to be followed by Malaysia.
Thank you, Chair. We are deeply grateful for the hard work of WHO headquarters and W.H.O for the report. Our achievements last year in the areas of our core strategies, including universal health coverage and non-communicable disease, are very encouraging. Yet, we regret that the Western Pacific region received a rating of partially satisfactory from the audit when WHO as a whole is going through a financial difficulty. We are also concerned that the amount of budget secured for bolstering response capacities for health emergencies, such as a pandemic, is at a lower level. In order to maximize the effect of our limited resources, we need to strategically concentrate them in core areas, such as health emergency response and primary health care, and to ensure responsibility with transparent reporting of performances. In this context, we particularly welcome the structuring of the budget for the Western Pacific centering country offices. This is a desirable change that demonstrates the strong commitment of the regional office for meeting on-site demands. We can also consider further coordinating with external partners and institutes outside the WHO to create more synergy effect and avoid overlapping of efforts. The Republic of Korea is actively making efforts for complementing what is lacking in the area of health emergency response by working with the Seoul-based WHO Asia Pacific Center for Health and Environment in the Western Pacific region, ACE, and 24 WHO collaborating centers. In addition to that, we reaffirm our commitment to making efforts for enhancing health equity and health emergency response capacities, as already seen from our collaboration with the WHO with Global Training Hub for Biomanufacturing. We kindly ask W.H.O for making more efforts in enhancing transparency and raising efficiency in running the organization and bolstering the response capacities for health emergencies. The Republic of Korea, too, will continue to make efforts for building health capacity with the WHO. Thank you.
Call on the representative of Malaysia.
Thank you, Chair. Malaysia thanks the W.H.O Secretariat for the comprehensive interim report on the program budget 2024-2025. It is encouraging to note that the highest proportion of funds has been allocated towards Priority 1 for advancing universal health coverage, which has supported improvement in access to essential health services and medicine. And this has also contributed positively to Malaysia's own health white paper reforms. The resources allocated under the program budget have enabled Malaysia to advance several key initiatives, and we are pleased to highlight the progress achieved thus far. This includes the development of our first National Plan of Action for Children and Adolescent Mental Health, efforts to strengthen disability-inclusive health system, and the introduction of more stringent tobacco regulations. Malaysia has also integrated behavioral insight to improve health outcomes, invested in NCD prevention to realize long-term economic benefits, and raise awareness on the antimicrobial resistance through One Health approach. These achievements demonstrate results and alignment with the regional and global priorities made possible through valuable technical support of WHO. With regards to the program budget 2026-2027, Malaysia notes its well-structured plan aligned with the 14th General Program of Work and grounded in country-led priority setting. Despite the budget reduction, we welcome the greater allocation to country officers, bringing WHO support closer to the communities. We also welcome the identification of 11 high-priority technical outputs in the region, which strongly resonate with Malaysia's priorities, including workforce development, strengthening health information system, NCD management, and preparedness for health emergency. These priorities are closely aligned with our health white paper reforms, particularly in advancing purpose-centered services delivery, and are central to Malaysia's national agenda to build a resilient health system that leaves no one behind. Lastly, We look forward to continuing this partnership as we work together to deliver on the regional vision. And more importantly, with the budget constraint, we can work more closely with full transparency towards member state-driven priorities to ensure ongoing trust among member states. Thank you.
Thank you. Thank you for those interventions. Are there any more representatives who wish to speak on this topic? If none, and as your chair, I would just like to make a short comment, is that I really appreciate the strengthening of our country office. And we now call on the Secretariat to respond to the points that have been made.
Thank you very much. Thank you so much for your support for the work for our work on program budget. It's been a roller coaster for us, I think, and encouraging to hear that in many instances there is alignment with the country priorities. I'll respond to each one, and I think for some of the other questions that we have, we may need a little bit more time, Chair. Are we? Yes? Oh, okay. All right. Okay, thank you. Thank you very much. So I think there are some detailed questions about, in the case of Japan, some questions about underutilization in some country offices. And we are happy to note that and to discuss with you the circumstances around this. We do have a project management group that is looking at delays in implementation of funding that we have received over some period of time, and that has now landed in front of us because these donor funds are expiring or expired. We are not yet able to provide detailed information on the budget for 2026-27, as has been requested by Japan and Australia, as we are not yet in operational planning. We will go into operational planning in November, and at that point in time, I think it is possible for us to give a little bit more information about how what the breakdown looks like. I think from Japan, there was also a question around staffing by department. Our organogram has just been recently reviewed, and there is a change in the structure. So we used to have 5 technical departments, now we have 4, and there is going to be some staff movement into the larger cluster on health promotion and disease prevention and control. So at a future date, before the end of the year, we should be able to share that with you, including a breakdown of the budget by program or by unit or department. In relation to the questions on sexual and reproductive health, we had flagged this as an issue that is more effectively executed at the level of countries. And we are ready to provide you with what that breakdown looks like in country offices. But certainly at the regional level, this is one of those program areas which we felt would be best supported from the country level, and therefore the support will be coming from there, and we will be able to share that with you. I think in relation to prioritization risks, we also have mapped this out. We've mapped it out multiple times. And I think when we go into operational planning in November, we should be able to share more information with you on which parts of the budget for 2026-27 look like they're going to be funded or not funded. And as I mentioned earlier, the danger signals are really in the area of immunization and communicable disease. These are the areas that were most affected by the withdrawal of the United States, and these are the areas that we really have to protect to achieve health security. Let's see. Of course, all of the comments that reflect the relevance of the 11 priority topics to the countries and to the member states right now is very helpful for us. This was, of course, a product of many discussions with our country offices, and we hope to be able to, what should I say, be more strategic about how WHO is going to use limited resources to achieve what we want to achieve. Let's see, from China, there was an issue, there was a point raised about making sure that staff from underrepresented countries are not further reduced. We are very mindful of representation, and the regional director has taken many strides to make sure that we are correcting some of the underrepresentation in the region in relation to specific countries in the Western Pacific. We do have many ways of executing internal controls, and maybe Daph would like to speak to that shortly. I'll skip that part. From Fiji, okay, utilization of funds, yes. We monitor our funds every month, but programs actually monitor their funds every 2 weeks. So one of our objectives for this year is to really go down to zero in terms of funds that are not utilized. And in fact, all of our country offices identified the exact amount of money that they could spend by the end of the year, and we're going to hold all of our feet to the fire on this to make sure that limited resources are well used. For Vietnam, thank you so much for your comments on equity and resilience. We have made it a point to make this a cross-cutting thematic area for our work, and we are really looking at how do we create greater equity and resilience. And when the final numbers on the program budget for 2026-27 come out, you will be able to see that chronically underfunded budget centers, including the smaller Pacific Island countries, and programs that have been chronically underfunded have in fact been reprioritized. From Korea, we are very grateful for your support to the Asia Pacific Center for Environmental Health and the 24 WHO collaborating centers. We do see this as the asset of the region. In fact, there will be a meeting of the WHO collaborating centers in the first week of November. There are 190 collaborating centers throughout the region, and we are able to do our work mainly because of all these partnerships that we have established. For Malaysia, thank you very much for your comments on universal health care, essential health services. We are doing a lot of driving in that space to make sure that we can provide the support. But what we're seeing is that many countries are in fact implementing policies and investing and putting more money into primary health care. And I'll have to mention the Philippines, the country I know best, which has put into place many innovations for outreach activities, mobile clinics, and the Bukas centers. I'll turn over to Daph to comment a little bit on the internal controls, and maybe Arpit, you might want to say something.
Thank you very much, Susie, and thank you, Chair. So first of all, thank you very much for all the support from member states who have spoken. I heard many comments on staffing, on country support, and also on the use of digital technology. Now, these are the three pillars of our strategy, which is in line with the tier of change that derives from the GPW14. We are trying to concentrate on a people-centered approach. We are merging the Pacific spirit with the solution-oriented mindset. And we established last year a solutions lab in the admin office, which also embraces new technologies and AI to do a few things. To streamline operations, we have issued a handbook for delegation authorities, which gives more power to the country offices. We build capacity throughout the region in project management and the use of AI, so they become more efficient in delivering impact in the countries. We also have been developing new business intelligence tools to better measure our efficiency. And again, that trickles down to every level of our region and improves overall impact. In general, we just try to embrace new technology and encourage our staff to do that. So, for example, you have heard me saying this morning that we have a Bula bot that we developed for this RCM for the first time, and that's just one of the examples. It's a bot that you can ask anything, including where to change money around the hotel. So that's about technology and becoming more efficient because we have less resources, as you said. In administration, our overall administrative budget is about 8% of the flexible funds, and we have been reducing this further this year due to the funding constraints. At the same time, we try to take care as much as we can about our staff, and we have a staff counselor, we have an ombudsman, we also have a workplace culture program. So we are supporting, especially now at this time of heightened anxiety, it's very important to take care of our staff. And finally, I just want to mention one more aspect of internal controls. Of course, we are audited regularly. You remember, last year there was the IOSC report. This year we had several audits. And in this region, we have made it a commitment to always close every audit recommendation within maximum 12 months, if possible earlier. This has been the case for the past years, and we managed it also this year. We are working together with our country offices to strengthen their controls, build capacity of our admin staff around the region. And the new mindset is really to go out and support wherever there's a need. So the regional office is acting more like a central capacity where search support is available in case of need, and we build capacity on a regular basis. One more thing I wanted to mention is the Go W.H.O programs. Is a program we started some time ago, but we have been expanding it the last 2 years. And this is especially focused on countries that are under or unrepresented in WIPRO. So we are going to these countries, to universities, addressing mid-career people who could be interested in joining us, and try to coach them throughout the process so that relatively soon, we hope, when staff positions become available, they can join and strengthen our numbers. Thank you.
Okay, thank you very much. Did you want to say something, Arpit? Go ahead.
Yes. Thank you. And thank you, Member States, for all your feedback and comments. Just 3 specific comments I wish to make. I think Japan had inquired about the timeline of budget execution, and the presentation from DPM mentioned about the reports for interim progress 24-25 were dated June 2025, where the utilization rate was around 70%. And as of the end of September, that rate of utilization has already reached around 82%. And as we end the biennium, we are aiming to close the biennium by at least 96 to around 97% of utilization of our resources. There was also a specific question by Japan that into program budget outcomes, the level of funding was slightly in excess of the approved budget. As you know, this is the interim report. As we will report the final program budget report, these adjustments will be made. We do have, the regional director does have the authority to move some adjustments or make some adjustments in the program budget outcomes in a strategic priority level, and up to 20% those adjustments can be made. So these corrections will be applied in the end of the biennium report. And in relation to salary gap as well, the program budget document mentions about $2.7 million roughly of the salary gap at the time of the issuance of the report. But as it stands now, that gap has been further reduced to roughly $1.1 million. And finally, in relation to audit, just to supplement the comments made by DAF, we are continuously aiming to look at what are the root causes of some of these audit findings, and in line with the corporate approach, where we are now continuing to go back and see to it what are the root causes and trying to tackle them by means of what are the topmost areas of these areas of audit. And in relation to the audit ratings, the organization has a 4-tier rating when it comes to audit, and the partially satisfactory with some improvements is actually the 2nd-tier rating. And in the report, it mentions that Mongolia, Philippines country office audit, and also the administration and finance audit actually had none of the operational controls that were flagged as high residual risk. Any risk that was noted was either low or moderate. And we are continuously committed to address these root causes, work with all of our country offices in closing these recommendations timely and improving our controls. So with that, I hand it back to you.
Thank you very much, Arpit. Imre, would you like to comment on the comments? Thank you.
Yeah, just one, thank you. Maybe just one clarification or information that we're currently finalizing the program budget indicators, and we're going to present the final output indicators at the January Executive Board. So because there were many questions about indicators and how important it is to be to measure our progress with that. So I think that's important. And maybe the second
I think this whole prioritization and resource allocation discussion is particularly difficult in the WHO context, because we still, as some of the member states pointed out, the majority of our resources are still earmarked. And there's only so much you can do in terms of strategically allocate resources, and they really refer to the flexible resources, because earmarked resources are very difficult to change, just to sort of put that in context. Thank you. Back to you, Susie.
Thank you very much, Imre.
Thank you. Back to you, Susie.
Thank you very much, Imre. Before I turn over to the chair, I'd just like to thank everyone for your comments and to thank you for your support for shifting the priorities to the country offices, which has not been easy, but we are slowly getting there. I'd also like to flag, and this is related to the implementation of the outputs for GPW 14, and I've said it already twice, but I will reiterate. The program that will need the most support will be immunization. And we've estimated the additional requirement for each year to be about $30 million. So I just want to thank China for saying that, we should give more money to the regional office. And for those who are thinking about what we need to support in the region, it is the immunization program. So this is something that we cannot afford to fail at. And we do look forward to your continued support. And finally, thank you to all the member states for the increase in the assessed contribution. It's going to go a long way. Thank you. Over to you, Chair.
Thank you. Thank you, Dr. Mercado, Dr. Lendes, and Mr. Hollow. And like with any budget, it's always an important factor in the running of any organization. And if there are no further comments, the committee notes the program budget 24-2025 interim report and the program budget of 2026 to 2027. Thank you. We've now reached the end of today's session. Congratulations to every one of you who made it this far. We will reconvene tomorrow at 9 a.m. in the morning. This evening, there will be a dinner hosted by the regional director, which I know you're all looking forward to. This will be preceded by two events, a presentation from the World Bank and the very exciting launch of the ACE 5-year strategy. I would like now to invite the Director of Administration and Finance, Dr. Tamas Lendes, to remind us of the details. Thank you very much, and see you tomorrow.
Thank you, Mr. Chair. And I think you said most of the things that I was going to say. Just complementing that very, very quickly. I was told to be quick, so please bear with me. Just to the rapporteurs, I would like to kindly ask you after this meeting to go to the Reva room. You will have your first meeting. At 6 p.m., we start in this room here on the left side with the World Bank presentation, followed by our ACE office presentation until 6:45, and then we'll walk to the Croquet Garden, which is down the hall to the right side of the reception. It's a space where we are going to have some drinks organized for all of you. And after that, at 7:15, we are going to move back to the Golden Ballroom, where we were yesterday for the opening ceremony, where we will have the RD's dinner, and the much awaited RD's dinner, so we are really looking forward to that. There is a seating plan on that room. It will be on the walls, and the liaison officers will help you seated. And last thing, transportation will be available, of course, after the RD's dinner to your hotels. Thank you very much, and looking forward to see you. Thank you, Mr. Chair.
So enjoy your evening, enjoy the dinner, and as RD has just informed me now, please bring your dancing shoes with you.